Hello, my name is Tristan, and this is the intradermal injection skills video. I'm going to check the items, check to make sure I have the items that are needed. I have my gloves, my hand sanitizer, the tuberculin medication, the 1 milliliter needle, alcohol wipes, and gauze, and obviously my patient. I have a needle receptacle. I don't have a needle receptacle, so for this video I'm just using my water bottle as if it is the needle receptacle. Next thing I'm going to do is I will check the provider's orders, and then I will check the 6 patient's rights, which is the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Once all those check out, I will check in the EHR the doctor's orders, which is the tuberculin test 5 TU, which is 0.1 milliliter intradermal times 1 dose to give to the patient, and check that with the MAR. Okay, and then next I'll gather all my supplies and I'll head into the patient's room. I'm going to go into the patient's room, close the door behind me, make sure I use proper hand sanitizer, and introduce myself to the patient. Hi, Mr. Ramirez, my name is Tristan, I'll be your nurse today. I'm here to perform an intradermal tuberculin injection that was given to you by per your doctor's orders. I need to know, can you please tell me your first and last name and date of birth? Great, thank you. I checked that to the bracelet, and I got the 2 patient identifiers. Next thing I'm gonna ask, do you have any allergies to any foods, medications, environment, or substances? No, great, thank you. Next thing I'm gonna do is let you know that I'm going to give you an injection. The injection is tuberculin, and what that is checking is to see if you've been exposed to tuberculosis. Some common side effects are swelling, itching of the site, and when I give the injection, you might feel slight burning and stinging, but that is common with any type of injection, and any adverse effects would be shortness of breath, and happens in hives. And this happens. If this happens, let me know immediately. Do you have any questions before I begin? No? Great, thank you. Okay, so the next thing I'm gonna do is I'm gonna go ahead and use hand sanitizing hygiene with my gloves. Okay, so I have the right syringe here, which is a 1 milliliter 25 gauge by 5/8 needle. Okay, and then next thing I want to do is make sure I'm checking into my medication bottle to make sure that it's not expired, which is not. I'm gonna get my alcohol swab. Go ahead and clean the top off. I'm gonna let that dry. While it's drying, I'm gonna prepare my needle. Okay, I wanna make sure that's completely dry. Next thing I wanna do is I want to, while the cap is on, pull down 0.1 milliliter of air into the syringe, okay, which I have. Not sure if you can see that, but okay. The next thing I'm gonna do is I'm gonna go ahead and I'm gonna take my cap off. I'm gonna put that into my vial, push the air down into the vial. Then I'm going to invert my vial, and I'm going to withdraw 0.1 milliliter. And I want to make sure that there's no bubbles, no air bubbles in here. And if there is, I'm going to go ahead and hit the vial to make sure that there's no air bubbles. And that checks out. So I'm going to pull this down, put my vial down. Then I'm going to use the swoop technique and cap my needle. Okay. Once that happens, next thing I'm going to do is I'm going to change my gloves. And while I'm changing my gloves and hand sanitize, once again, I'm going to be thinking about my site. So I'm going to check my site that I want, and it's going to be in the forearm. And what I want to do is make sure that I take 3 fingers. I'm going to check my site. I'm going to go for the inside of the forearm, which in the antecubital, and take at least 3 fingers from the antecubital down, and then take a hand length, the width of a hand from the wrist up, and somewhere in the middle right there is where I want to go ahead and check the site to make sure that there's no discoloration, no redness, no inflammation, and if there is, I'm going to go ahead and switch arms to check to make sure for the same. Once it looks good, I'm going to go ahead and I'm going to palpate to make sure that it feels good and looks good. And once that's done, I'm going to change gloves one last time. Hand hygiene. I don't have any more alcohol swabs, so I'm going to have to, for the purpose of this video, use the same one again. So I'm going to go ahead and get my alcohol swab, and I'm going to go to my site that I picked out, and I'm going to clean the site in a circular motion on out about at least 2 inches. Okay. And then I'm going to let that dry and make sure it dries really well. Then the next thing, what I'm going to do is take the cap off the needle, and then with my non-dominant hand, I'm going to actually grab the skin and taunt it tight. And then I want to make sure that I go in at 5 to 15 degree angle, and when I go in, gonna make sure I go in slowly, but I'm only gonna go in about 3 millimeters, and if I feel pressure, it means I went in too far. Then I'm gonna go ahead and inject the medication slowly. Okay. And once I do that, I'm going to go ahead and I'm going to get a piece of gauze, lay the gauze down, take out my needle, and do my swoop. Okay, and leave that there. And then I'm going to make sure that I throw this away, my needle, into my needle receptacle. And then I'm going to make sure that when I was injecting, I want to make sure that I seen a wheal or like a bleb, and it should be about 6 millimeters to 10 millimeters. And I'm not going to push any of that down. And then once that's done, I'm going to go ahead and make sure I take my items and go ahead and start to throw this into the receptacle. Okay, and count my medication. And then I'm going to make sure that I check with the patient to make sure that there's no side effects or adverse actions going on. Make sure that they're okay. Give them a call out, make sure that they're comfortable. And then go ahead and remove my gloves. Throw that in a receptacle, proper hand hygiene. And then what I'm going to go do is go out and document what transpired in the room and the medication that was given and the patient's rights, the right patient, the right drug, the right dose, the right time, the right route, the right documentation, and then that's it. Great, thank you.